Welcome to Counselor Soapbox video, Learning About Alcohol, Part 25, the therapies used in treating substance use disorders. Some of the therapies that might be used in treatment. 1. Aversion therapy. The idea here is to give some condition which is painful or unpleasant to prevent the person from continuing addiction. One example is the drugs that can be given, which if the person takes them every day, when they go to have a drink of alcohol, they become violently ill and it's very unpleasant. Generally, aversion therapy has not been very effective, though a few people have said it was helpful. Alcoholics frequently either won't take the pills or will go ahead and drink, be very sick, throw up, and then they're able to drink again. Another therapy which is often used, or treatment method, is 12-step facilitation. 12-step groups are self-help groups, and professionals should not be running them, but it is possible for a professional counselor to teach the client the various steps without actually working through them or with only working the first couple of steps. There are lots of behavioral interventions, teaching behavioral skills, but the idea that clients need to learn specific things or they may need to learn social skills. Motivational enhancement or motivational counseling is a very important part of most counselors' trainings. And another possible therapy is a medical replacement therapy, used sometimes for heroin addiction or for some other drugs. Some other treatment approaches. Therapeutic communities were one of the early efforts to bridge the gap between self-help groups and professional treatment. In those treatments, groups of addicts or alcoholics got together, had their own residential facility, and they participated in helping each other and in working towards sobriety. Recently, there's been a movement towards what we call new media, Facebook and other social mediums. There are groups which may meet or positive affirmations which are posted online. Distance counseling or e-therapy was a highly controversial thing only a couple of years ago, but the result of the COVID epidemic meant that many people were unwilling to go into a residential treatment facility or go to face-to-face counseling, and as a result, counselors have had to learn to work using the internet and video conferencing, and in the future I expect that's going to be a lot more common. There are more and more web-based, even computerized programs which have minimal counselor involvement. There's also spiritual or faith-based. There are many faith-based programs in every city, it seems. And some other alternative stress management techniques, things like meditation, mindfulness, and various stress reduction techniques can also be combined with standard drug and alcohol treatment. Treatment topics which might be covered. Primarily, this is relapse prevention. Need to understand that relapse is not an event, but is a process. Often it begins with cravings. It begins in the mind with people thinking that they might want to use again. And one thing counselors need to talk about is the difference between willpower and won't power. Willpower is that thing where you force yourself to do something unpleasant, such as exercise, so that you'll be healthier in the future. One reason most willpower techniques don't work for urges and cravings for drugs is that, in fact, it's a different skill, won't power, that's involved. Won't power is passing on something that might feel good or relieve pain right now, but will be harmful in the future. It's that not having that second piece of chocolate cake, which is hard to do sometimes, or turning down a drink when you know it would be bad for you. And another area that's important to talk about and develop in treatment are support systems. Everyone needs a support system, and that can't be simply one person, your spouse or partner, or one good friend. Having more than one person in your support system increases the chances that you will be successful in establishing sobriety. An important topic that needs to be covered in treatment are triggers, both internal and external. External triggers are things that you might encounter, people, places, or things. The people you used to drink or use with are likely to set off the urges. Going to places where you used to drink, the bar, for example, or having things around the house that remind you of your drug of choice, having posters about marijuana or posters about various alcoholic beverages. Those are all triggers. Internal are physical and emotional states. One acronym that's used in treatment is HALT. Hungry, angry, lonely, or tired. Not eating or not drinking enough water can be a trigger. Becoming angry is a trigger, or tired, lack of rest, and especially loneliness. Many people go out hunting for someone else and end up in a drug-using situation or a drinking situation when they're feeling lonely. Learning to surf these urges, that is, when you begin to experience these things, do productive ways of making your body feel better without resorting to drugs and alcohol, is an important part of recovery. Other topics that are covered in treatment at various programs: unhelpful thoughts, sometimes called irrational or dysfunctional thoughts, that belief that I did one mistake, so I'm stupid and I can't succeed. Those need to be addressed, and there are a great many thinking distortions, black and white thinking and so on, that need to be looked at. There's also the matter of recovery lifestyles. There is a culture of recovery. Culture is made up of a lot of elements: how you dress. When you get into recovery, you stop wearing your beer company themed sweatshirts and t-shirts. You stop talking in the same way, and you go to different places. All of these are elements of the culture of addiction, and people in recovery move from that culture of addiction to a culture of recovery. Some other components of professional drug and alcohol treatment that are important to think about. Activities. Many people are used to all of their activities revolving around their drug of choice. So programs may create clean and sober events. Teaching clients how to have fun in recovery. For most people in our culture and many others, the way that people think they have fun is to drink alcohol, use drugs, engage in sex, and those sort of things. Those are very temporary spikes of dopamine pleasure, but they're not necessarily fun in the long run. So people need to learn to play and enjoy themselves without drugs and dysfunctional behavior. Part of recovery may focus on fitness and well-being. Part of that, an important part, is smoking cessation. A great many alcoholics and addicts also smoke nicotine or marijuana. Weight loss may be a part of it, and developing a great many life skills that are needed for just living life clean and sober are important components of treatment. What's ahead on the Counselor Soapbox video channel? More videos on drug counseling, drug education, mental health, and wellness. If you've enjoyed this video, please click the like button below. Comments are always appreciated. And if you want to see new videos in this series, please subscribe. Thanks for watching. For more information, please visit my blog, counselorsoapbox.com. David Joel Miller fiction and nonfiction books are available on Amazon.